Last night, the first 3,900 doses of the Pfizer COVID-19 vaccine arrived at the Calgary International Airport. They have been transported to distribution centres, unfrozen, and the first inoculations have already begun. I understand that the first to receive it, just received the vaccine moments ago, was respiratory therapist Sarah Kahie at Edmonton's University of Alberta Hospital, and that intensive care nurse Tanya Harvey at the Foothills Medical Centre in Calgary is also receiving the vaccine as we speak. We expect to receive and begin administering another 25,300 doses of the Pfizer vaccine within the next week. We are establishing COVID care teams with our municipal and local community partners in Edmonton and Calgary in order to provide on-the-ground outreach and very practical support to help Albertans living in such highly affected communities. Statistical analysis conducted by Alberta Health and the Emergency Management Agency have identified 11 communities in particular with the highest rates of COVID transmission in the province, 9 of which are in Edmonton and 2 of which are in Calgary. These areas require an additional layer of public health support over and above the measures put in place province-wide. Albertans in these particular communities are at higher risk of COVID-19 due to absolutely no fault of the residents there. The residents of these communities often have public-facing jobs which may make them more susceptible to community transmission.
Over the last 24 hours, we have identified 1,341 new cases of COVID-19 in Alberta and completed about 16,350 new tests. This means our positivity rate currently stands at 8.2%. This is a continuation of the plateau in cases that I talked about yesterday. There are 742 people in hospital, including 137 who have been admitted to the ICU.